Okay, I'm going to I'm gonna go ahead and take my mask off so you can hear me, but everybody's a good 10 feet away. And so anyway, thank you for covering this. We're out here at the first site in Louisiana that's going to be a drive-through testing site. The first site, and it's here at the Walmart on the Shreveport-Barksdale Highway. The state, local, and the federal officials got together and talked about exactly where the best place would be to have an additional site for testing, and we came up with this. This is the place that it should be. This is going to be for first responders and for medical personnel to begin with, and that's because we wanted to have a soft opening, and they thought that would be a group that could be managed pretty well and get all the kinks worked out. And very soon we will go into expand the folks that can come out and actually be tested here. What you need to do is, you see on the front of this podium, you'll have to go to Quest Diagnostics, and it takes an appointment to go through. It's a very simple process. You'll sign up, and then you're able to get an appointment time. You'll come out here, you'll drive up, get the test taken, and very shortly, within just a couple of days, you should get your results. This is something that, like I say, we're all learning. We're all going through this process, and we're trying to get into a better shape with our testing, along with everything else. This is going to relieve the hospitals some too, because the hospitals they have plenty to do, and they have a lot of people being tested at this particular time. And so this site here at the Walmart that will assist us with that. So Walmart, Quest Diagnostics, the Louisiana National Guard has been instrumental here, the city of Shreveport and the parish of Caddo, and Homeland Security. Everybody's had to pitch in to do their part to get this going for the citizens of Caddo Parish, and of course that's Shreveport also. So we're going to try to get all the kinks worked out, and we'll be able to up and go. It's going to start at Thursday. We'll get started. It's from 9 to 4 daily, weather permitting. And like I say, to begin with, this will be just for first responders and for medical personnel. Then it will be expanded to whatever groups, 65 and older, or whatever that we decide the capability will be for the site. But I appreciate everybody that's here, and appreciate everything that everyone is doing. And also on another point, very quickly, but it's very, very important. I know we see on television and hear on the radio and read in the paper that things are getting a little better, which simply means that things are leveling out. But we don't know exactly how level it's going to get. We don't know what the new normal is. We don't know much about this animal that we're fighting. So I want everyone to understand that the only reason that it's leveling out, this curve that we keep talking about, is because of the things that we're doing, such as social distancing, washing your hands, that sort of thing. We've got to continue doing that no matter what the numbers show, because the numbers are coming down because of that. I compare it to a LSU football game. If you finally get 3 points ahead at the end of the first half, when you come back out, you're not going to just bench your defense, you're going to up everybody's game, and that's what we got to do. We've got to, just because we're starting to win this thing, if in fact we are, it's not the time to let our guard down. It's the time to get your defense even better. And so, having said that, I will introduce Dr. Martha White, and she will help us understand.
Hello. We just wanted to really let everyone know about this site. It's a site that's really one of the few in the country. Walmart came to us and wanted to offer a chance to do an extra testing site for us. This is the site that they chose, and we think it's a good one. We hope that people will utilize it. The goal is to start with first responders, but that includes healthcare workers. We also want to make sure people know it includes people working in nursing homes, you know, your personal care attendants and your nursing assistants, people who have been worried about where possibly they should go to get tested. We want them to know that if they're symptomatic, for sure they can come here. Also, I want to let people know that testing should not be charged to you. It's a free thing. You know, don't fear going to get tested. Don't fear getting care. This is a serious disease. People who are getting terribly sick are getting terribly sick quickly. So don't take your symptoms for granted. If you start having a shortness of breath, difficulty breathing, please take it seriously. Please call your doctor or go directly to the ER. They'll take care of you. I've seen it personally. I know it for a fact. It's a quick-acting disease, and people are dying from this illness. So please, you know, get yourself checked. Don't be afraid, and make sure that you get the health care that you need.
Thank you, Martha White, and thank you all the news personnel for being here for another weekly update. Thank you to our sheriff and acting Homeland Security Director. I always love your analogies. The Caddo Parish Commission is appreciative of the partnership with corporations in our parish like Walmart, who have made the safety and welfare of our first responders and healthcare workers a priority. The addition of this mobile testing site is a proactive step in the fight against combating COVID-19 in our community. We have so many essential workers who are residents of Caddo Parish who are on the front line each and every day. As we navigate the COVID-19 crisis, we are so thankful for the sacrifices they are making, leaving their families, working long hours, and placing themselves at risk to minimize ours. They are in our thoughts and in our prayers daily. The Commission remains committed to working with our state, local, and national partners to fight this pandemic and to ensure the safety and well-being of the citizens of Caddo Parish. We continue to ask everyone to please continue to follow social distancing guidelines and to please adhere to the governor's stay-at-home order unless it is absolutely essential. I really thank Walmart for doing this, and for all the personnel that are at home that are watching. This is obviously for first responders, but what I like is they said, if you are a healthcare provider, if you are taking care of loved ones, if you're in the profession that you are providing care to other people, go online and fill out the questionnaire. And like Martha said, it's free. You can show up and get tested as well. If you're an x-ray tech and you're worried, may I have the COVID-19, you can get online as well, fill out the questionnaire, and show up and get tested. So please do that, and please follow the social distancing guidelines, everybody. Shreveport Mayor. Oh, hold on one sec, guys. Martha White would like to say one more thing.
The one question I've been asked that nobody here's asked me, so I want to make sure we address it, is when can you go back to work? When are you considered well enough that you can go out again? So you have to have had at least 7 days from your first symptom. So say I started on Monday and I started with a fever. That next Monday is the earliest I could possibly go out. But then also I have to have 3 days of no fever with no medications. So if on that 7th day you're still having fever and a lot of symptoms, you're not ready to go out yet. And it, you know, I think it's been misunderstood that after 7 days you're okay. If you're afebrile for 3 days, at that 7 days, yes, you're okay. But if you're still having fever, still having a lot of symptoms, please stay home and take care of yourself.
As always, I want to start by thanking the media for coming out here and allowing us to share this good news with the community. And this is a great time to actually be putting out some good news. Although this is the 5th drive-in site in our community, it's something for us to celebrate today that it is the first drive-through site in Louisiana that is testing first responders. That is a huge thing for our community. Our first responders and our healthcare workers are on the front lines in this battle against COVID every single day. They wake up, they suit up, and go into harm's way to better protect all of us. We have to do everything we can to protect them in return. We have to keep them safe. Shreveport EMS personnel, firefighters, police officers, and healthcare workers are who stand between us and our public health catastrophe. I want to personally thank them from the bottom of my heart for everything that they're doing every single day. I also want to thank Walmart. Walmart has stepped in to meet a very, very critical need in our community. Not only are they providing this site for people to come and do the drive-through testing, but they've also provided the funding for this to be possible. So a big thank you to Walmart for being good corporate partners and neighbors in our community. The number of positive cases in Caddo Parish continues to rise. As the sheriff already pointed out, the rate has slowed a little bit in the last 24 hours, but over the weekend we saw a massive jump. We're at 800 cases and sadly 25 deaths. I throw out those numbers, but I always have to remind our community when you hear those numbers and they go up every single day, that they aren't just numbers. These are our friends, these are our family members, these are our parents, our grandparents, people we go to church with, our co-workers. So we really have to do everything that we can to continue to slow that spread. So hopefully we see that number, the rate of increase, continue to slow over the next coming days. But we know for a fact that what is slowing that rate is our diligence as a community, us doing the right things. And by right things, I mean making sure that we are taking social distancing serious, making sure that we're keeping that 6 feet between us and other citizens, we're washing our hands, we're not going outside unless for work, for healthcare needs, or for nutrition. We have recently seen that this virus is exacting a disproportionate toll on the African American community. Roughly 70% of the COVID-related deaths in our state is African Americans, and it's about the exact same here in Caddo Parish. I want everybody to hear me with this. This virus does not care about race or gender or where you live. No one is immune to it. But those with underlying conditions are at a higher risk of acquiring this disease. We need everyone to take this very, very seriously. We need you to stay at home as much as possible and continue practicing social distancing. If you know someone who isn't taking this situation seriously, please call them and talk to them. Tell them their actions endanger not only themselves, but the whole of our community. That wraps up my remarks, and I'll take any questions from the media at this time.
Does this impact anyone else from those first responders coming here?
Yes, first responders, yes. First responders in our immediate area can utilize this site.
Do you see in the future that there will be stricter regulations on gatherings, if we do not reach a local agreement on shorter plateau?
Yeah, absolutely. And it's one thing I do want to add. The city of Shreveport, when this first started, we were getting a swarm of complaints throughout the community of people violating the governor's orders and the issues that were put out. But we have seen those complaints slow in the last couple of days, so that leads us to believe that people are doing what they're supposed to do. If we continue to see those numbers rise, or if we continue to get complaints at the level that we saw before, yes, Mario, everything is on the table for us to slow the spread of this virus. A curfew is not on the table for us right now. I talk to the sheriff about that pretty much daily because people are asking us about it. Because if you think with a curfew, we really would be funneling people to those places where they go every day anyway for food. You know, the big box stores would have even more people in it. So that's the reason why we haven't gone to a curfew just yet.
What has been the economic impact?
The economic impact has been dire, and there's no exact way for us to know that right now. All we can do is estimate and predict what impact it'll have. Right now, we're guessing that this will stop on April 30th. It's an educated guess, but we don't know. This virus gets a vote as well. So the economic impact has been bad throughout the community. Just yesterday, the city of Shreveport, we put out our numbers. Our CFO did a very good job allowing us to predict out into the future. And just with what we know now, we're looking at a $25 million, roughly $25 million shortfall with our money towards the end of the year. So we're having to make some serious adjustments, some serious cuts, and that started at the top. That started with myself and the other senior leaders in city government.
Mayor, you kind of alluded to this. In addition to some staff pay cuts, how else will the city fill the projected $25 million loss in general fund revenue?
I'm sorry, the mask, I couldn't hear it. Yeah, go ahead.
How will you guys fill the general fund revenue in April besides just the cuts to staff?
Yeah, so again, we know cuts are going to be made. So senior leaders, we made those cuts. As far as decisions on how we're going to make up that gap, we have not made any yet. What we did yesterday was we updated the city council, their finance committee chair and vice chair of the council Councilwoman Lavette Fuller on the situation. So we're going to continue to work with them. We're going to continue to work with the CFO on the cuts because we have to pay our bills at the end of the day.
Did you guys get a federal bailout?
Could we get I would hope we would get a federal bailout, but at this time, what we've seen, the CARES Act does not specifically address that. Maybe in phase 2 or phase 3, we can get a federal bailout, but at this time, that money's not allocated, so we need to plan accordingly.
Along those lines, what do you see? Will there be any cuts in city services other than public safety?
I'm sorry, would
Will
that
there
be?
be any cuts in service or public safety? Excuse me, excluding public safety, which we know is the first priority.
Yeah, and let me tell you, there is no cut in public safety. There is no cut with essential services right now. Those essential services have to be given to the community. So no, the cuts aren't necessarily there, but again, we don't know where exactly we are going to make cuts. But everything has to be on the table because we have to pay our bills at the end of the day, just like a lot of our citizens are trying to figure out right now for themselves.
Trash collection still continues, recyclables still continue, everything is trying to keep as normal.
Yes, the essential city services will continue. Now, if there is an impact on the level of services that we provide, that can very well be the case. But again, we have a commitment to the citizens of Shreveport. We have essential services that we have to provide by charter. We will continue to provide those services.
Thank you.
Can we expect to see more mobile testing sites soon?
Could we? I would hope so. If the virus continues to go at the rate that it's been going, yeah, I would hope so. I'm actually reaching out to the healthcare systems in the city and also reaching out to the Caddo Commission as well to try to have a meeting so we can focus on the hot spots that we've talked about over the last couple days and see if we can get resources in those particular areas. So I would hope we can get more mobile sites.
You would like to see those mobile sites in those hotspot areas?
Potentially, but obviously this is an economics problem. We only have so many resources, but trying to figure out where we can put those resources, what we can afford as a community, is kind of what we're going to go through over the next couple days.
Have y'all noticed any more hotspots?
So we update that data every day. What we're seeing is actually those hotspots are becoming even more concentrated with numbers. So again, it's very imperative for us to have this meeting soon and try to figure out how we can curb those numbers in this area.
Can I just say something to that? Just know that a point on a graph doesn't tell the story behind the point on the graph. So it's important that we focus resources where they're needed. I agree, absolutely. But also know it doesn't say that those people are not doing the right thing, or perhaps it was brought into their home in a way that they couldn't control. So just know that that's not a negative. To be called a hotspot in your neighborhood is not a negative. It means that there is a need for your neighborhood, and we want to make sure that we're meeting that need.
Yeah. This isn't a blame game at all. We aren't trying to stigmatize neighborhoods whatsoever. What we're doing is trying to bring awareness of where this virus is concentrated in our community, similar to what you see when you see the state maps every day that shows that Shreveport has over 800 cases. What that does is allow us to bring awareness to that area and be able to, again, bring resources into those areas as well. All right. Anything else?
Thank you, Mayor.
All right. Thank you. Appreciate it.
Any questions from anyone else? Y'all ready to get out of the heat?
Yeah, my